So we have this preparation we're doing now with Belotero. There's 1 ml that's delivered in syringes, and even though this has a lower chance of Tyndall effect, according to the studies and even acknowledged by some company executives from the competitive companies, I still like to bring the solution down to around 5 milligrams per deciliter. So I'm taking basically our connector here, and I'm going to put connect this and put the Belotero HA into the roughly 3 mLs, which is going to be 1 part product to 4 part solution, if you will. And I have 4 mLs, so dividing that by 4 gives us 22.5 milligrams divided by 4 is, in the 5 milligram per deciliter range, which is where I feel like it's optimal. And then I'm just simply putting this into solution, and I don't think you can do this too much. In fact, I'll often have my assistant sort of sitting in the background doing this, sort of mixing between the 2 syringes and making sure I don't have any parts of the HA that are more concentrated. And then I'm simply drawing it into my delivery syringe. It's too hard in a big 5 ml syringe and a 30 gauge needle, which is really the key for fine lines. And these 2 little components have been very successful for us in the absence of the Cosmoderm product, which I think was obviously the ideal product for fine lines. And I'm just going to draw this up into the syringe, and then I'll often have my assistant actually will just take a 1 ml BD syringe that's got a bezeled, screwed bezel for the needle on it, a locking bezel. Okay, so and we're ready to go. Treatment, and that's, you can see that's a little extrusion, but the key is getting intradermal here. I mean, I should see, and hopefully that's visible on the camera, a little wheal like that developing in the skin surface, which is an indication that I am intradermal. And the more intradermal we are, the better effacement of the line it is. If I am subdermal or even deep dermal, what I'm going to do is push the line toward the surface and not really treat the line itself. Are you okay there, Al? I'm not even going to use your name for purposes of keeping your identity highly classified.
So far, so good.
So far, so good. And if it develops a little superficial wheal, I'm okay with that, but as long as the line is effaced is the important thing. And so I'm just, doing this with serial point. You can't, linear threading sounds appealing, but it is so hard to do this with linear threading. And I think anybody that remembers the Cosmoderm days knows that this serial point injection is a far superior way of treating a fine line. And then the patient themselves will massage this when we're done. If there's a little swelling, that's not a problem. You can see the depth of this line that's adjacent to the one I just treated. And just laying down little sequential beads. If you start near the top of a lip, it's helpful because the innervation comes from the top. And ultimately in a lip like this, you're pretty much laying down a layer along the entire upper lip surface intradermally, and that effaces all the lines. The hydrating effect that the HA has is also a large benefit, and it really comes down to, in the end, how smoothly you can lay these products down with serial point injections. So I think, and we've gone over this with the patient, the more, the optimal treatment for this is either serial fractional laser resurfacing or full laser resurfacing, which actually works much faster but has longer recovery times. But in the end, this sort of ultra dilution method and mixing of an HA filler is what I find to be the optimal treatment methodology for perioral and other fine lines, frankly. It doesn't have to be just in the perioral area. For people who want to do this over being treated with some resurfacing method, all of which I think work very well. Peels, laser, even dermabrasion would work great on this.